Hello, my name is Bir Singh Khalsa, and I'm an assistant professor of medicine in the Division of Sleep Medicine at Harvard Medical School. And I've been doing research on sleep and biological rhythms since about 1995. And I'm also the director of yoga research for the Yoga Alliance. What I want to speak to you today about is what we know about sleep physiology, or how sleep works in the body, and then also recommendations about the quality of sleep and how to get quality sleep. So let's start with some very, very basics. These are facts that many people may not be fully aware of. First of all, sleep's really a biological need. It's something that's wired into us. In fact, it's wired into every organism on the planet virtually. It is a biological need. And when we violate that biological need, just like if we don't get enough food or enough water, we suffer the consequences. Another thing that's important to understand is that if you really want to understand sleep, you also need to understand wakefulness. These are two sides of the same coin. And in fact, there are some sleep disorders where there's no symptoms in sleep, but there's symptoms in wakefulness. Another feature about sleep is that it's a very active process. The brain is very, very active during the sleep process. There's different stages of sleep, and different processes occur within those stages of sleep. And just as an example of that, you know how active a dream can be when you're having a dream in the middle of the night. So it is a very active process. Finally, it's also a very complex process. There's many different regions of the brain that are involved, many different neurotransmitters, and many different behaviors. And there's a very complicated pattern of sleep that occurs over the course of the night. And let's take a look at that pattern. So this is what's called a hypnogram, and it looks at what's called different stages of sleep. These are different manifestations of sleep. What we have is two types of sleep: rapid eye movement sleep, which is typically referred to as a sort of a dreaming state. That's where you have most of your dreams. And then there's what's called non-REM sleep. And these different stages of non-REM sleep come in different levels of sleep. And actually, there are different levels of depths of sleep. So stage 3 and 4 is your slow wave, or your very, very deep sleep. Whereas stage 2 is the sleep that you have sort of your average run-of-the-mill, most of the night kind of sleep. Now, what's very interesting about this pattern over the course of the 8 hours that you're in bed at night is that there's a very discrete rhythmic patterning of the different sleep stages. So at the beginning of the night and the first half of the night, you're experiencing a lot of your very deep, slow wave sleep. This is the sleep that you're not conscious. And it's a very, very deep and very satisfying stage of sleep. And that occurs in the first half of the night. Whereas the second half of the night, what occurs more and more often is the REM sleep, this dreaming state of sleep. And that tends to predominate. The other thing that you'll see is that there's a cycling, and this is a roughly 90-minute cycle that occurs throughout the night, alternating between REM sleep and non-REM sleep. So this is very clearly a very complicated pattern. And the other thing that's noted on this hypnogram is brief awakenings. These are not unusual. People do wake up to turn around, to move, maybe go to the bathroom, and these are not unusual. Now, there are physiological determinants of sleep and wakefulness, things that determine how well you sleep or how well you're awake. One of these is the biological time of day. We have, or what's called circadian phase. Circadian means about a day. In fact, we have a biological clock in our brain which keeps time. And if you take that biological tissue out of the brain and put it in a petri dish, indeed, it will cycle at close to 24 hours. And it keeps the biological time of day. The other thing that biological clock also has an influence on your ability to stay awake during the day and your ability to sleep at night. Another determinant is the number of hours you've been awake. So there's a process in the brain that keeps track of how long you've been awake. So the longer you've been awake, the more sleepy you are. And it's what's called an hourglass phenomenon. It's similar to hunger. The longer it's been since you've eaten, the hungrier you are. And this is called sleep drive or homeostatic drive. Another factor that can contribute to your sleep or wakefulness is how long you've been sleeping over the past week or 2 weeks. So your nightly sleep duration. So if you sleep deprive yourselves and let's say sleep only 5 hours a night for 3 nights, that sleep debt actually accumulates. So nightly sleep duration will contribute to an overall increase in sleep drive. So it's like, interest. You have to pay that interest back. It accumulates over time. And then finally, another minor contributor occurs just after you've woken up from a night's sleep. There is a period of time that your brain requires before it comes to full functioning. And it may last up to an hour and a half. That's called sleep inertia. So depending upon where you're at in your body with your biological clock, how long you've been awake, what your sleep's been like for the past week or so, and whether you've just woken up, that's going to determine how wakeful you are or how sleepy you are. Now, there's a model that really sort of accounts for how our sleep is regulated. It's called the two-process model. And one of the contributors to that is what we've talked about, sleep drive, or the homeostatic drive. So this is over the daytime in the yellow. The sleep load or sleep drive increases over the course of the day. And then when you go to sleep at night in this light blue bar, that's when the sleep drive dissipates and you pay off your sleep debt when you go to sleep at night. And this is process C, or the circadian process, the biological clock drive. And what the biological clock does is it keeps you awake in the last half of the day. That's when it's strongest. And then it's weakest in the night. In fact, it actually contributes to your allowing to stay asleep late in the night. So these two processes have a very tight time relationship. And that time relationship allows us to stay awake for the 16 hours of wakefulness and allows us to sleep over the 8 hours of the sleep episode. And these need to be synchronized to each other. If they're not synchronized to each other, you end up with problems. And those problems are most familiar in terms of things like jet lag or in shift work. Now, in terms of sleep disorders, there's three major categories. One of these is parasomnias. These are very, very strange disorders, and they're of fairly low prevalence. Things like nightmares, sleepwalking, sleep eating disorder, and that kind of thing. And we're not going to discuss those. We will discuss, to some degree, disorders of excessive daytime sleepiness. In this category, people may not have a complaint of nighttime sleep, but they will complain of not being able to stay awake during the daytime. And then what the most common sleep disorder is insomnia. That's the inability to fall asleep or stay asleep, or difficulties with sleep in general. In terms of the daytime sleepiness types of disorders, two that are sort of wired into the central nervous system are narcolepsy, or primary central nervous system hypersomnolence. We won't be talking about those, but these are serious disorders that really are truly sleep disorders. They affect the nuclei in the brain that are involved in sleep regulation. Another way to get daytime sleepiness, of course, is disrupt your sleep. One of these is a disorder that's becoming more and more prevalent, obstructive sleep apnea. This is really a breathing disorder that wakes you up in the middle of the night below your level of consciousness and actually makes you sleep deprived because you don't get enough sleep at night because of the respiratory interruptions over the course of the night. And then there's two sort of related disorders, periodic limb movement disorder and restless leg syndrome, which really are experiences in the musculature. And it's an unpleasant feeling or a repetitive tensing of muscles, and that can disturb your sleep at night. But perhaps the most common way to have excessive daytime sleepiness is simply inadequate sleep, not getting enough sleep. And what we will be talking about is what's called self-imposed sleep restriction, people not sleeping enough and therefore having a sleep deprivation during the daytime. And one of the things that can also cause that is that dysynchrony between the two components of sleep, the homeostatic drive and the clock drive. And that is one example is shift work or jet lag. So let's turn our attention to something that we can have an influence on, and that is self-imposed sleep restriction. We live in a high-paced modern society, and a lot of people don't recognize that sleep is a real biological need. And so as a consequence, we have a significant amount of sleep disturbance. This is a consensus statement from sleep researchers published a few years ago. And what they conclude was that adults should sleep 7 or more hours per night on a regular basis to promote optimal health. This is the recognition of sleep drive and sleep need. Sleeping less than 7 hours per night on a regular basis is associated with adverse health outcomes. And here's the consequences of violating that sleep need. It includes weight gain and obesity, diabetes, hypertension, heart disease and stroke, depression, and increased risk of death. So this is a serious thing if you violate your biological sleep need on a long-term basis. And it's also associated with impaired immune function, increased pain, impaired performance, increased errors, and greater risk of accidents. And we'll be talking about some of these. So what's happening in the population? This is a survey in US adults comparing statistics from 1985 to 2012. And what we see here is the average hours of sleep in a 24-hour period. And I want you to pay attention to the two bars on the left. This is less than 6 hours a night on average. So these are people, this is almost 30% of the population in 2012 is getting less than 6 hours of sleep on average. And that is up from 1985. So this is a huge percentage of the population that is walking around sleep deprived, paying all those consequences, and it appears to be increasing over time. And this is something that the sleep research community is really working very hard with public knowledge to try and get people to recognize that sleep need, and also working with government agencies to enhance education and knowledge about this. So what are the consequences? Well, one of the consequences of walking around sleep deprived all the time is cognitive performance. You are not functioning, your brain is not functioning at the optimum level. This was a laboratory study that was done looking at sleep deprivation. And what's on the vertical axis is what's called PVT lapses. This is a performance test. And this is a computer test in which people fail to recognize the signals from the computer that they're supposed to react to. In other words, they completely lose it. They zone out or have a micro sleep. And what you can see is that the number of lapses for someone in this curve here, this is complete sleep deprivation for 2 days. So they're awake for 2 days straight. And not surprisingly, look at all the lapses and how rapidly they're going. And these two conditions are getting 4 hours of sleep at night and 6 hours of sleep at night. And what you can see is that after 2 weeks of getting 6 hours of sleep at night, they are as impaired cognitively as someone who has been awake for 2 days straight. So that's how serious your cognitive impairment can be if you continually sleep deprive yourself. And that cognitive impairment is easily at the level of alcohol. And so we have restrictions on alcohol consumption for driving, but we don't have restrictions, but should have in terms of sleep deprivation and driving a vehicle. The graph on the right is your self-rated sleepiness, how sleepy you feel. And so this solid line here with the squares, this is the person, these are the people that have been awake for 2 days straight. So not surprisingly, they're rating themselves as very, very sleepy. And after 2 days, you know, they have very high levels. But look what's happening with the people who are doing 4 and 6 hours a night. Yes, they increase a little bit, but then they taper off. And so at this point in time, after 2 weeks, they're not rating themselves as that sleepy, despite the fact that they are very, very seriously impaired. So this is actually very similar to alcohol. People can be over the alcohol limit in driving a car and yet believe that they are capable and fully functional in terms of being able to drive that car. And it's the same thing with sleep deprivation. You can be very cognitively impaired and yet not be aware of that impairment. So this is how serious the cognitive impairment of sleep deprivation can be. Now, the list I gave you from that other review talked about endocrine function. And one of the endocrine functions that's impaired is glucose regulation. And that involves the release of insulin and the levels of glucose. And these are studies of people who spent in the laboratory 4 hours or 12 hours in bed. And what you can see is that the levels of insulin are much higher in people that spent 4 hours in bed as compared to those that spent 12 hours in bed. And the relationship between insulin and glucose highlights that even more. So this is really an indication that our insulin and our glucose regulation is disturbed substantially by sleep deprivation. In fact, we now know that sleep deprivation is a negative risk factor for the development of type 2 diabetes. And You can see this on this chart here, and I won't go into the great details of this, but short sleep duration is one of the reasons you can get insufficient sleep. And through a number of impacts, including decreased brain glucose utilization, ultimately you lead to increased insulin resistance, reduced beta cell function, and hyperglycemia and type 2 diabetes. So there's a very clear pathway that we understand now from research that's telling us that this could well be a risk factor for type 2 diabetes. Now, because sleep deprivation works on a number of other neurotransmitters and hormones, it's also a risk factor for obesity. And one of the ways that it's doing this is it's increasing the levels of changing the levels of two appetite hormones, leptin and ghrelin. These work in opposite ways, but when you get sleep deprived, that leads to an increased intake of foods. People get hungrier when they're sleep deprived. And so your dietary intake behavior changes, your intake behavior changes, the amount of food and the composition of food, the quality of food, all of these change towards high carbohydrate levels. You eat more frequently, you have irregular eating behavior, and even the intake and distribution and timing changes. So you have more evening intake. And all of that becomes a risk factor for obesity. And obesity is linked in many ways as a comorbid condition, often with type 2 diabetes. Now, let's talk about something that is very current and relevant, and that's the negative impact of sleep deprivation on immune function. And what this review paper shows, and I won't go through the details on this, but it shows that when you sleep deprive yourself, you are making changes in a number of neurotransmitter levels, including a number of stress hormone levels that ultimately lead to reduced immune functioning. And that means that you are more prone to infectious diseases because your immune system is not functioning as well. And so that also leads to an increase in the pro-inflammatory markers. So you are more susceptible to inflammation as well. And these can all be risk factors for things like cardiovascular disease, cancer, major depressive disorder, and certainly with the COVID virus, of being more susceptible to infectious diseases. And actually, one of the recommendations that the governments are making is get enough sleep at night, because that keeps your immune system functioning better. And just to show you that this is a real phenomenon, this was a study that was done on sleep deprivation in response to an immunization. And what you see here in these two charts is sleep-deprived subjects on the left and control subjects on the right. Each pair of dots is a single subject. And what it's measuring is the immune response. It's your response to the immunization in these subjects. And what you can see is the sleep-deprived subjects have very little increase, whereas those people who are control subjects who are getting normal sleep have a much stronger immune response to that immunization. So very clear evidence that we're seeing immune function degradation with sleep deprivation. And if you want to see this in the real world, there's a study that was recently published in military recruits in the UK. And these military recruits go through an intensive training, and they studied them during the training period. And they looked at the amount of sleep these recruits were getting and the number of upper respiratory tract infections they were getting. And what you can see very, very clearly in this chart is that those that were on average getting less than 6 hours a night were getting respiratory tract infections than those people that were sleeping between 6 and 9 hours a night. So here, very clear evidence that if you don't get enough sleep at night on a regular basis, you are impairing your immune function and increasing your risk of getting an upper respiratory tract infection, like a cold and like COVID. So let's finish off with probably the most common disorder and something that many people complain about, that's sleep disturbance or insomnia. And it comes in different varieties. You may have different difficulty falling asleep, staying asleep, or just poor quality or restorative sleep, or a combination of all of these. It becomes significant when this amount of sleep disturbance is more than 30 minutes on at least 3 times per week, or more difficulty falling asleep that's more than 30 minutes 3 times a week. This should be occurring for about a month or perhaps as long as 6 months before it sort of becomes clinically significant. And the other thing that that's important is that there should be a significant daytime impairment, such as mood disturbance, cognitive difficulty, or sleepiness that's associated with this. This is when it becomes clinically significant and goes out of the realm of sort of not sleeping well into what we call clinically significant insomnia. Well, clinically atypical insomnia is highly prevalent in the population. The overall prevalence estimate of broadly defined insomnia from a US survey is 23.6%. So this is a substantial fraction of the population. The other thing is that given that sleep insomnia impairs your sleep, and that's violating your sleep need, insomnia is associated with substantial decrements in perceived health. And it's a major risk factor for a number of other disorders, particularly mental health disorders such as depression, anxiety. And of course, we've talked about physical disorders such as the risk for obesity and type 2 diabetes. So the impact of insomnia is widespread across the body. In fact, it's amazing how much sleep has an impact on other physiological systems in the body. So insomnia is a risk factor for many medical illnesses, and many medical illnesses have as a symptom chronic insomnia. So for example, major depression, one of the major symptoms is sleep disturbance. And many people with type 2 diabetes also complain of difficulty with sleep. Many psychiatric disorders, as I've mentioned, insomnia is a risk factor for the development of psychiatric disorders, and psychiatric disorders have as a comorbid symptom insomnia. Insomnia can cause cognitive impairment, can lead to higher healthcare costs, increased accident risk, higher absenteeism from work, but also presenteeism from work. In other words, people are at work but not functional. And then, of course, reduced quality of life as well. So this is a major issue and needs to be addressed when someone has chronic insomnia. Insomnia treatment, one way to treat insomnia that's secondary to other conditions such as pain, depression, anxiety, or sleep disordered breathing, or those other disorders that we talked about. This is secondary insomnia. In other words, you're not able to sleep because something else is going on to obviously disrupt your sleep. Well, one way to treat that is to treat the underlying cause. So someone with major depression, with insomnia, you treat the major depression, and oftentimes the sleep problem will go away. Another treatment for so-called primary insomnia, in which the insomnia exists all by itself without any sort of underlying obvious cause, is sleeping pills, pharmacological treatments. I'm not going to discuss these. One of the problems with these, of course, is that there are side effects. Another problem is that, from my perspective, they often do not treat the underlying cause of the insomnia. They simply mask the symptom and let you fall asleep, knock you out. And so it's not uncommon for people to take sleeping pills for many years, and as soon as they stop, their insomnia comes right back to where it was. And the other problem with pharmacological treatments for some patients is that they're resistant to them. It'll work for a couple of weeks, they'll try another sleeping pill, that'll work for a couple of weeks, and then finally they don't work at all. So what I really recommend as a first-line treatment for difficulties with sleep are behavioral treatments. And these come in a variety of different characteristics. Sleep hygiene, these are general sleep-specific recommendations for facilitating sleep. So a wind down period before you go to sleep at night. Try to avoid excessive sleeping during the day so that you can put your sleep drive towards the night. Avoid caffeine in the late half of the day, or if you're very sensitive to caffeine, avoid it altogether, because caffeine is a rousing agent, will keep you awake. For people who are really experiencing more along the lines of insomnia, there's a thing called stimulus control, in which you're conditioning your body. You're associating or reassociating your body's sleep patterns with good sleep, with sleep in the bedroom. And you try and do that by conditioning yourself that all you do in the bedroom is sleep. Cognitive behavioral therapy works on dysfunctional beliefs and thoughts during sleep, and that's a very powerful technique. This alone can have a great impact on insomnia. Sleep restriction works on improving the depth of sleep at night by limiting the time spent in bed and eliminating daytime napping. And then the other thing that I think has a real impact on sleep is relaxation training. Relaxation treatments employing cognitive or somatic or physical techniques to reduce tension and arousal. Because tension and arousal is the opposite of what you need to fall asleep. If you're feeling anxious or stressed, it's much more difficult to fall asleep. So it's very clear that as you go into relaxation training, you're going to sleep better. In fact, there's actually a hypothesis of insomnia as a disorder of hyperarousal, that it's the elevated arousal that produces the poor sleep and other symptoms, and that the treatment should include strategies that are directed at reduction of arousal level in insomnia patients. So let's talk about some of the really good behavioral treatments for reducing arousal. And of course, meditative movement yoga is one of these. Yoga is very well known for its ability to reduce stress. And in fact, this review paper summarizes a number of the studies that have been done showing that meditative movements have some potential for improving clinically significant insomnia. In fact, you can mix these behavioral treatments together in what's called cognitive behavioral therapy for insomnia. And if you add meditation and yoga to these practices, there's no reason you can't add them together. They're all behavioral treatments. And this is an example of the Benson Henry Institute for Mind Body Medicine, which had a sleep disorders program. And what they found was that in using all of these elements, they were able to show significant and moderate improvement in many patients. They were able to eliminate or reduce the dosage of existing sleeping pills. And over the long term, 6 months later, half of the subjects or half of the patients, their improvement was enhanced, and in the other half, improvement was maintained, and very few people regressed to have poor sleep again. So it's a very effective way to treat sleep disturbance problems. And of course, I believe that yoga is probably the best type of relaxation treatment. It incorporates many different components, including the meditative and the physical component. This is an ad that suggests that a sleeping pill will help you sleep at night, and therefore you're more willing to do your insomnia in the morning. And so I'm proposing that if you do yoga, you won't need the sleeping pill. And there is some evidence for that. So this is a paper in the International Journal of Yoga Therapy. Yoga practice is well suited to complement existing therapies and to address sleep problems in a more holistic way. Yoga teachers and practitioners have long touted the positive effects of yoga and meditation on sleep. Improvements in sleep are among the first and most often valued changes observed by new practitioners. Yoga is already one of the top 5 alternative medicine interventions for insomnia based on consumer surveys. So what's the evidence? Well, this is a study of long-term yoga practitioners, and what they found is that the sleep scores are better. Lower score means less sleep disturbance. And so long-term yoga practitioners actually sleep better than the normal population. This is also true for elderly yoga practitioners. And what you can see is that same questionnaire, the PSQI, and the scores are lower in the yoga group than they are in the non-yoga group. Furthermore, people who practice yoga over the long term actually agree with the statement that their sleep is better because of yoga. 68% agree or strongly agree with that statement. And furthermore, in a study looking at long-term yoga practitioners and how often they practice frequency was correlated with improvements in sleep disturbance. So the more you practice yoga, the better your sleep appears to be. And just to show you one clinical trial of a few that have been done, this was a study that was done in India in elderly who sleep, in which insomnia is much more prevalent. You can see the sleep onset latency is decreasing after the post-treatment and maintained at the long-term follow-up. Their sleep duration is increasing, whereas control subjects really had no improvement over time. And we've done a study with a yoga intervention from the Kundalini Yoga tradition, which I practice, called Shabad Kriya. And this was a technique they practiced every night for 8 weeks. And this was a randomized controlled trial compared to sleep hygiene, which was a low active treatment for insomnia. And what you can see in the blue line, this is the sleep onset latency, how long it took to fall asleep after 8 weeks. And you can see that decline. And then 6 months later, you can see how much better that is than the control sleep hygiene, which had some efficacy. Total wake time during the night is decreased and slowly improving. Sleep efficiency, the percent of time that you're asleep for the amount of time that you're in bed, increases substantially. And then the total sleep time going from less than 6.5 hours a night to almost 7.5 hours. So very clearly we can see these changes that can be beneficial to insomnia patients with a yoga intervention. And this is the Shabad Kriya practice. In case you are interested in looking at this, this is the 3HO Foundation website, which promotes the practice of Kundalini Yoga. This is the description of Shabad Kriya and how to practice it. The website link is here, and there are a few videos online that people have put on this particular practice. There's another practice in Kundalini Yoga. We have a full set of yoga exercises that's meant to be good for working on sleep. And I've practiced this set myself, and it really is very powerful. And if you want to practice a single asana alone, one asana that really works well is what's called table pose in Hatha Yoga. We call this bridge pose in Kundalini Yoga. You just hold this for 5 minutes, let it go, repeat a second time for 5 and 10 minutes, and a third time if you can. If you do this before bed or in the middle of the night, it can be very beneficial. Sort of an alternative to this is what's called Setu Bandhasana or bridge pose in Hatha Yoga. It's a little bit easier to do. And again, I find these postures really beneficial in terms of short-term improvements in sleep. But I think if you practice these regularly, your overall sleep will probably improve. And the website for this particular set is located down on the bottom right. So by way of acknowledgements, I work with the International Association of Yoga Therapists. I'm the editor of the International Journal of Yoga Therapy and coordinate their symposium on yoga research. And I also am the director of yoga research for the Yoga Alliance. And that's sharing what we know about the science behind yoga and the research behind yoga as a form of research literacy education. And what we've collated and curated is a number of research citations. So you can go onto this research page. This is open access, and you can even find in these different categories, you can find sleep and sleep disturbances and look at the review papers. There's links to the review papers, to the full text and or the abstracts for accessing the research. And then I'm also supported by the Kundalini Research Institute, which supports the style of yoga that I practice, which is Kundalini Yoga. So thanks for your attention, and I will now start to take some questions, and whether you've got them in the Q&A or the chat. So if you have any questions in the, please type them into the Q&A or the chat box, and I'm happy to answer any questions that you might have. So there's one question that's come in. I was just wondering why that particular yoga pose was good, was good for sleep. Great question. I have no idea. And that's probably the case with a lot of yoga practices. They work very well, but in some cases we have no idea why they work so well. That's actually, ironically, it's particularly true of the asanas. We know a lot about, for example, we know a lot about slow breathing. There's a really good deal of research showing how slow breathing has real positive benefits. We're understanding that physiologically very well. We also have a very good understanding of how the meditative component of yoga and meditation alone is working, especially from the neuroimaging studies that are coming out. And we get a good idea of the neurophysiology of meditation. But when it comes to the postures and the asanas, that's difficult. We don't have much information on why these are more beneficial, but we do have some evidence that the yoga asanas and postures are somehow better for you than the typical Western type aerobic exercises. And of course, we know that the yoga asanas are very different than Western aerobic exercises. There's a lot more flexibility, a lot more isometric. There's a lot more postures. There's twisting, bending, there's balancing poses. And so they're very different. And they have a very different effect on the body, of course. And through the mind-body connection, they likely affect your cognitive and emotional performance very differently. So here's a question. What do you think of using acceptance and commitment therapy for insomnia? So there is a whole body of research now over the past 5 years or so on mindfulness practices for insomnia. In fact, what they've done is they've published studies on mindfulness alone, mindfulness meditation alone, showing positive benefit. MBSR has been tried, and they've actually created now a version of MBSR called MBTI, mindfulness-based therapy for insomnia. And that mixes together the standard behavioral treatments for insomnia, such as stimulus control and cognitive behavioral therapy, together with mindfulness practice. And commitment and acceptance are sort of related very tightly with mindfulness practices. So I suspect that, yes, that would be beneficial as well. So here's a question. Did you mention blue light from screens as a factor? So the thing about blue light is that blue light is the light that is most effective at changing the timing of your biological clock. Now, the biological clock is set by your daylight exposure, and it's most sensitive to blue light. So if you get a lot of light in the evening, you're going to delay your biological clock to a later time, and you're going to sleep later, and you're going to go to bed later. And that may interfere with your sleep pattern, especially if you try to go to bed the next night. At the same time, you'll find it's taking you longer to fall asleep. And the same happens in the morning. If you were to have a lot of blue light exposure in the morning, a lot of daylight exposure in the early morning, you would shift the biological clock earlier. So one of the things about screens is that they have blue light. And so if kids are staying awake or adolescents are staying awake or you're staying awake at night, getting a lot of screen exposure, you're getting a lot of that blue light at night. And what's going to happen is it's going to shift your biological clock later, but you're still trying to go to sleep at the same time. So now you have what's called desynchrony. Your biological clock is no longer fully aligned with your desire to go to sleep or your sleep pattern, and that's what's going to cause a sleep problem. So that's the whole issue with blue light exposure. Here's a question. I have a friend who is trying to quit smoking weed after more than 20 years. His brain is currently rather wired. He has a bad chest pain and many other symptoms. He suffers from a bad insomnia. Nothing is working. Can you advise what might help? And again, my recommendation always is to go after behavioral treatments for insomnia. And that would include something like a yoga or mind-body practice like Tai Chi or meditation or slow breathing or whatever. And the other thing about this is that there's a lot of resources on the internet on behavioral treatments for insomnia. So that's a resource you can go to. The best resource, of course, is to go to a sleep clinic. First of all, to get diagnosed, to make sure that there's not an underlying problem that's causing your insomnia, a secondary problem like depression or like obstructive sleep apnea, to rule that out. And then also to get a formal training in cognitive behavioral therapy for insomnia. Usually this is a behavioral program that's 8 weeks long and you go once a week and then you do homework. And this is a pattern that takes time to behaviorally change your sleep pattern. So that's what I would recommend for someone like that. And then of course, in the care of someone in a sleep clinic, a sleep specialist, if all of those behavioral strategies fail, then there's sleeping pills to fall back on. So here's a question. Does it matter on the type of yoga? For instance, I've started Yin recently. The only thing that I would suggest in terms of the type of yoga is to pick a yoga that is more traditional. And what I mean by that, it's not just asanas. It incorporates the breathing, and incorporates the relaxation, incorporates the meditation. Because all of those different components have studies that have been done showing their benefit. There are studies showing relaxation treatments alone have improvements in insomnia. There's studies showing meditation alone has improvements in insomnia. So if you practice a style of yoga that incorporates all of those components, you're more likely to get benefit. And that's already been shown in a number of studies looking at other treatments with yoga, such as hypertension, where it's found that those styles of yoga that incorporate the breathing and the meditation are more effective than those that just really rely and focus on the postures and exercises. Here's a question. Can someone who has had insomnia for over 30 years recover from the condition? I think it's possible. I do think it's possible, although, you know, there are people who have really serious insomnia that may be genetically based that may prevent them. But unless you really try, you don't know. But I think it's really quite possible that people can recover from a long history of chronic insomnia. And you never know until you try. Again, first line of treatment, I always believe, is the behavioral treatments. Another question, my 11-year-old son is type 1 diabetic and takes insulin. Since his diagnosis 2 years ago, he tends to suffer from nightmares and wakes around 5 a.m. most nights. He then goes back to sleep. Could the waking be related to his insulin glucose levels? Possibly. I don't know. I'm not a specialist in glucose regulation or diabetes, so I don't know the answer to that question. But one way to find out, of course, since he has a serious clinical condition, is to go to a sleep specialist. And again, you have to look for a sleep disorders clinic, preferably a clinic that's associated with a university. You're going to get higher quality clinicians in that kind of an environment. Get yourself into a sleep clinic, get him studied overnight to see what is waking him up, because that's what happens in a sleep study overnight. You go into the sleep lab, you sleep there all night, they monitor everything, and then they correlate your awakening with what's going on in your body. And they might see something in his behavioral patterns at night that points to why he is waking up. Well, I'm not seeing any more questions, and I think we need to wrap it up. But thank you for your attention. And obviously, the recommendation here, especially at this time, respect your sleep. Get enough sleep. If you're not sleeping well, get into a mind-body practice. If it's really significant, then address it, because there are treatments for insomnia and sleep disturbance that can be very, very effective. And again, I always recommend the first line of treatment is behavioral strategies. So hope you all stay well and safe. Thank you for your participation.